Snoring generally has several causes, but the commonest cause of snoring in children is enlarged adenoid and tonsils. Yes, there can be a relationship between snoring and speech, whether in articulation or speech delay. A child who has enlarged adenoid and enlarged tonsil may have problems articulating certain letters, and so this will not affect how the child pronounces certain words. In addition, an enlarged adenoid can cause hearing loss, which will now lead to problem of speech and language delay. So if a child has developed hearing loss due to the enlarged adenoid, this may equally affect the language and speech.